come in?
Okay. Hi.
Good morning, Mr. Jones. I want to introduce you to your daytime nurse. This is Bethany.
Hi, nice to meet you. I'm Bethany. I'll be your nurse till 7 p.m. I've been a nurse for about 2 years now. Kelly's just going to give me a little update on what's been going on, okay?
Okay.
All right.
Okay, so this is Mr. Jones. He's a 73-year-old male, patient of Dr. Wynn. He came in on the 14th. No known drug allergies, and he's a full code.
Okay.
So he came in yesterday. He was at home having some shortness of breath. So he called the emergency, or called 911. EMS came, and it turns out he was in AFib with RBR.
Okay.
As far as his history, he has a permanent pacemaker. He has a history of 2 cardiac stents, HIV positive, chronic kidney disease, CAD,
Okay.
and chronic back pain. Are there any other things that I need to update Bethany on? No? Okay. So, for the AFib, when he was down in the ER, they did 2 20-milligram boluses of cardizem, and then they started to titrate the drip, and they wanted to keep his heart rate less than 100.
Okay.
Currently, his heart rate has been fluctuating between the 90s to 110s, and the cardizem drip is at 5 milligrams per hour. Assessment-wise, he's alert-oriented ×3. He answers all questions appropriately. I've had him on 2 liters nasal cannula, and he's been with his oxygen saturations at 95% or above.
Okay.
Are you having any shortness of breath right now? No? Okay, good. Blood pressures have been great, runs like 110s over 80s, and he's been afebrile my shift. Skin is intact. He voids per urinal, and he's had very good output overnight.
Okay.
He's had a bowel movement yesterday morning before he came to the hospital. He has had pain in his back, and we've been giving him 2 Norco 5s,
Okay.
and I've done that twice on my shift.
Okay.
I've updated on the board that the next time he can have pain medication is 8 a.m.
Okay. Mr. Jones, what would you rate your pain right now, 0 to 10? 3? Okay. Your next pain meds due at 8 a.m. Is that going to be okay? Okay.
He has a 20 gauge in his left forearm, and that's what the cardizem is going in through, and that IV was put in on my shift last night.
Okay.
He ambulates with a walker and just a standby assist to the bathroom. I do have him as a fall risk because he is a little unsteady on his feet.
Okay.
So we've got the yellow armband, the yellow socks, and the fall risk sign on his door.
Okay.
I've also kept the bed alarm on him for safety. Procedures, they did an echo on him, and his ejection fraction is 25%. His BMP when he came in yesterday was 516, so they gave him 20 milligrams IV of Lasix in the ER.
What about his troponin?
His cardiac enzymes have all been negative. So I think that's it for his assessment. Can you think of any other questions?
I don't think so. Do you
Okay.
have anything to add, Mr. Jones?
Okay. So I'm just going to show Bethany the cardizem drip here. Here it is going at 5 milligrams per hour. We've got new tubing, and it's all dated and with the stickers. I've also given him his medication side effect sheet,
Okay.
and I've circled the medications that he's on, and he's aware of that.
Alright. Alright, Mr. Jones, I'm going to put your bed alarm on for safety, and I also have your call light here. Call us for any reason you'd need to get out of bed, okay? I'm going to update the whiteboard with my name and number. And I will be rounding on you every hour during the day, if not more frequently.
And we're just going to check off your orders, see if there's any new orders.
I don't even know. Okay. Alright, let's look at your orders.
Okay, so there's no new orders from last night.
And I'm going to be updating the rounding log when I come in. We're just going to be checking on what we call the 3 Ps, which is pain, to see if you're having any pain, needing any pain medicine, to make sure you're in a good position, that you're comfortable, and that if you need to go to the restroom, we can help you with that, okay?
Potty needs.
Potty needs, yes.
All right, Mr. Jones. Well, thank you so much for letting me take care of you last night, and thank you for your time this morning.
I'll be back in about 15 minutes. I'm going to get a report on one more patient, and I'll come back and see you, okay?
Bye,
All
Mr.
right.
Jones.